Good morning, everybody. My name is Nagachandrika Pallam, M.Pharmacy, Assistant Professor working in Sri Datta Institute of Pharmacy. I'm discussing Unit 5, Bioequivalence Studies, and the topic of designing and evaluation of bioequivalence studies for the B.Pharmacy third year, first sem. So in previous videos, what we have discussed about what is the bioavailability and various terminology of bioavailability and what are the different types of bioavailability and why it is needed the bioavailability that we discussed in previous videos. So now we are discussing the elements of the study protocol. So what is the definition means? So we need to consider the following points of as a protocol as a protocol, and which you need we need to proceed various steps. We need to decide about these steps before going to a study the subject. So study the protocol. So what are those title and study objectives, study design, study population, clinical procedures, ethical considerations, data analysis, and drug accountability appendix. All those things we have to consider. So first, what is this subject study objective? So this is we have to decide that what kind of study we are going to perform and how to access this study. All those things coming under the study objective. Study design is nothing but the factors have to consider in conducting the bioavailability studies, that are the rate and extent of the absorption of the drug into the systemic circulation, and the subject factors like sex, age, and disease state, and food habits, body weight, and time of administration, sampling, analytical methods, and compartment model, compartmental model you are using in a pharmacokinetic parameters, and subject. And next one is the selection of the study design, and a number of means how many number of formulations you are taking, and what are the characteristics of these drugs and its dissolution, and also the study objectives and availability. So whether these subjects are available or not, we have to consider. And inter subject, you have to consider the studies of the inter subject studies or the intra subject studies, that we have to mainly consider. And the study duration, how much period you have to study, that also very important. And dropout study, when you have to stop this study, that also very important. This is nothing but the study designing. And the next one is drug products. So how, what are the which formulation you are taking, means antihypertensives you are taking, or the otherwise anti-diabetics or the antibiotics, which products you are taking, that we call it as a drug products. Dosage regimen, how much per day, how many doses you are introducing to the subject, that is also very important. That is coming under the study design also. And the sampling collection, so already I told you samples how to collect, for IV route how to collect, and oral route how to collect these samples, and housing confinement, and fasting state, how you have to maintain this fasting state before, if you are taking meals, means how to take, when you have to administer the drug, and after getting all this data, how to analyze this data with the analytical methods. All those is coming under the study design. So the study population, so which subjects you are taking, okay, means you are taking the adults or the infants, or you are studying under the geriatric patients. So on which population you are studying, the which population subjects you are taking, that is very important. And subject is subject selection. So if you are taking adults, means what is the range, what is the range it should be 12 to 14 to 20 years, or 20 to 40 years. So which range of which age of the subject you are selecting, that also very important. Inclusion and exclusion criteria, and restriction and prohibition. So what you have to what are the instructions we have to give this population, that also very important. And Next one, study main objective. What is study main objective? That is nothing but the, if you are taking the two formulations like a test and a reference, these two formulation drug bioavailability should be compare, and you are saying that these both are the same, and it is not statistically different. You are proving by this study design. And how we are taking same molar concentration you are taking, and the same route of administration you are taking and conducting on the subject with the test and the reference, and you are saying that there is no statistical different. We are finding that we have to analyze. Next, study designs means fasting study. Okay, sorry. Okay, study designs is nothing but the fast study, means overnight fast, means if you are administering a drug, the before that, if in fasting study, how you have to conduct, before 10 hours you should not take any food. You have to be fast for 10 hours before administering a drug. And not only that, after administration also, after dosing also, you have to fast for at least 4 hours. And next one is 1 week before, no other medication should not be take after taking this administration, means 1 week, at least 1 week you should not take any other drug. Otherwise what will happen? Drug interactions happen, and drug means toxicities, it leads also toxicities. And for food interaction studies, is nothing but the which type of food you are taking. Whether you are taking low calories, there is no need to consider. But if you are taking fat and high calorie diet you are taking, means you have to wait for 30 minutes, means after 30 minutes you have to take administer your dose. So why it is taking, means the food with this oral drug product will affect the bioavailability of the drug. So many factors will affect the bioavailability. And the next one is study design. So how we are designing this study? So already you taken the population, and you taken the these subjects you are taking, and which conditions you are administering, all those things you studied. But how you are designing, how you are giving these dosage forms to the different subjects, and which method you are following, that we call it as a study design. So here this is a 2-period crossover design, and a Latin square crossover design, replicate crossover design. These three we call it as a crossover design. In crossover design, mainly three types. One is 2-period crossover design, Latin square crossover design, and replicate crossover design. So in next one is the balance complete block design, very important, and parallel group design. Okay. So in crossover, sorry. In crossover design, what is the crossover design? Crossover design is nothing but the minimize the effect of the inter-subject variability in the study by using the each subject as his or her own control. Means here inter-subject study you are taking. In parallel design, the intra the intra-subject subject variability you are studying. So parallel design is nothing but the intra-subject, and crossover design is nothing but the inter means with two subjects, how the formulation is affecting with the with the two subjects, means two persons, how the drug is acting, how the bioavailability we are finding, that we have to analyze. Intra means within the same subject, means in one person, how the drug is acting, means when we are giving repeatedly, the how the person is reacting, that we call it as a parallel drug design, means block design. So next one is the your two period crossover design is nothing but the two formulations here you are taking. See, two formulations you are taking and two groups like sequence 1, sequence 2 you are taking, and here in group 1, 1 to 7, 6 subjects you are taking, and in group 2 you are taking them 6 to 12 subjects, 7 to 12, 12 subjects you are taking. Means total how many subjects you are taking? Total how many subjects you are taking? 12 subjects you are taking. 6 you are grouping group 1, and 7 to 12 you are grouping as a group 2. Okay, so period 1, period means period 1 is nothing but the at the same period how many drugs you are introducing to the subject groups, that we call it as a period 1. In period 2 is nothing but the in that under period how we are administering the drug to the subjects, that we call groups, that we call it as a group period 2. Means here suppose you are giving 10 o'clock, 10 o'clock time is the period. So 10 o'clock period on that group of 6 on 6 subjects, which drug you are administering, test drug you are giving. Okay, on 10 o'clock period only you are giving the reference to the another group. So one group you are giving the test and another group you are giving the reference. Next period means not exactly for example I am telling, if you are giving that 11 o'clock, that means 11 o'clock what you are giving in group 1 you are giving the reference, and group 2 you are giving the test. So in between this period washout period will be there. So washout period is nothing but the complete elimination of the doses from the body. Means that is a complete disposition is nothing but the metabolism and excretion, both should be eliminated from the body. Okay, that we call it as a washout period. So how much period we have to take the washout period, that will be discussed in washout period. Okay, so next is the Latin square crossover design. Here we are taking the 3 formulations like A, B, C formulation, 3 formulations you are taking, and 3 subjects. We are taking the 3 subjects and we are conducting in first period. Means for example, if you are giving 10 o'clock, 10 o'clock you are giving for first subject A formulation, and second subject you are giving B formulation, and third subject you are giving the C formulation. Means 3 formulation you are giving. And as second period what you are giving, you are not repeating the same formulation, so you are altering. So next first subject you are giving B, second subject you are giving C, and third subject you are giving A. So there are no repetition. Okay, different formulation you are giving. So third period also, in between the period 1 and period 2 there are washout periods. You completely eliminate the drug, otherwise what will happen, drug interactions will happen. Sometimes the drug potency also will be increased. So that's why we have to we have to consider the washout period also. Next, coming to this replicate crossover period. Replicate crossover period is nothing but you are taking 4 periods you are taking, and 2 sequences. Means group 1, group 2 you are taking. Means 1 to 6 subjects is nothing but the group 1, and 7 to 12 groups is nothing but the group 2. Okay, here 2 formulations, but only but you are taking 2 formulations only. 2 formulation means test and reference only you are taking, but you are giving repeatedly on the same patient. Okay, that we call it as a replicate crossover. Means you are repeating the same formulation on the same subject, that we call it as a replication crossover design. Parallel group division is nothing but the 2 separate groups you are taking and giving the test product and the reference product. Okay, 2 parallel groups means same subject, you are parallelly you are giving the test product and reference product you are giving, and observing the long elimination half-lives also you are taking. This is, we call it as a sorry, call it as a parallel group design. Next one is the balanced complete block design. Means on the same subject you are giving the different formulation. That means you are giving the, it is a intra subject study. See here you are taking the period 1 on 3 subjects, 1 to 3 subjects you are giving the A formulation only. Okay, and 4-5 subjects you are giving the B formulation, and 7-8-9 you are giving the C formulation, 10-11-12 you are giving the D formulation. So in second period what you are doing, so on the first subject you are giving the B, and second subject you are not repeating the B here, so you are changing the formulation. So here you are giving, already you given A, so that's why you are giving the C. So next you are giving the D. So like that in B formulation already you are given B, so there is no we are not repeating the B formulation in second period. Okay, except B you are giving the all formulation to the 4-5-6 subjects. And C in C formulation, C formulation in first period you are given for the 7-8-9 subjects. So except C you are giving the A, B, D subjects to the 7-8-9. Okay, and the second period. And here see third formulation is fourth formulation is the D formulation, and you are giving to the 10-11-12 subjects, and but except D you are giving the A, B, C formulation to the same, to the different subjects. So this is the balanced complete block design, that we also call it as a pilot study also. Okay, next multiple dose study. Multiple dose study, so multiple dose study is nothing but the, you are giving the you are administering the doses multiple times. We have to calculate, how you will calculate means Cmax, C minimum. So Cmax is nothing but the maximum drug concentration, that is nothing but the at which period the drug is showing the maximum concentration, peak concentration, that we call it as a Cmax. C minimum means the minimum concentration level at which point it is showing the minimum concentration, that we call it as a C minimum. So degree of the fluctuations is nothing but the Cmax minus C minimum by Cmax. So swing, how you are calculating means Cmax by C minimum by C minimum. Here Cmax you are taking, here we are taking the C minimum. Okay, next drug products. Drug products, how you are taking the drug products, reference products you are taking. So reference products, how you are taking the reference listed drugs only you are taking. Reference listed drugs, already I told you, reference listed drugs are nothing but the FDA approved drugs that will be published in a orange book. Orange book, whatever the drugs published in a orange book, that drugs we call it as a reference listed drug. Okay, so the reference listed drugs we are taking as a reference product, and otherwise innovator or the original manufacturer brand name product we are taking, and fully approved FDA. These products are nothing but the fully approved NDA. And the next one is the test product, is nothing but the generic product. Okay, next one is sample collection. I already told you the samples, how to collect the samples. So for IV route, how you have to collect within 15 minutes. So you have to take the we have to conduct the bioavailability studies, because it is directly reaching to the systemic circulation through IV route. That's why we are taking within 15 minutes only. You are taking the samples. We have to conduct the bioavailability studies, and every 15 minutes, every 30 minutes you have to conduct the studies. For at least you have to take 7 biological half-lives. For the oral route you have to take 3 biological half-lives, and 3 half-lives, 2 to 3 half-lives you have to take. Already you know that half-life is nothing but the time taken for the 100% of the drug is reached to 50% of the drug. How much time it is taken, that we call it as a half-life. The 3 to 4 Tmaxes you have to take, and 4 points of the during the elimination phase you have to take. And next one is subject selection. How we have to take the subject should be a healthy adult volunteer, and the age should be 18 to 45 you have to take. Okay, if you are taking a geriatric patients, how the age should be below 60% you have to take. And pregnancy woman test, only the first dose of study only you have to conduct the woman pregnancy test. And before only you have to conduct these studies. And select the number of subjects is nothing but the pilot studies and previous studies and published data, everything you have to take in. And the next one is the exclusion criteria, means what are the conditions you have to take before, means before we have to check the subject is having any chronic diseases or any HIV diseases, or fast 6 months it is the patient, the subject is suffering with any disease, jaundices, otherwise the patient is suffering with any psychiatric illness. And if already he participated in BA studies for the past 3 months, if he's administered or not, everything you have to be considered. So that is the criteria of exclusion. And institutional review board, who will take where from take the permission, means IRB, means safety, God's rights and welfare, human rights. So with that permission you have to conduct the studies on the healthy human voluntaries. And what are the members of the RBIA, means the professionals only, the members, that is the medical professionals and lay persons with the clinical expertise as well as the sensitive to the ethical issues you have to take. The parameters to be measured, so what are the parameters you have to take? The pharmacokinetic parameters you have to take, and Cmax, Tmax and AUC. Already you know that Cmax is nothing but you have to plot the PTC profile you have to take. PCT profile is nothing but the time versus plasma concentration. So here time versus plasma concentration, you are taking the time on x-axis and plasma concentration on y-axis. Why we have to take x-axis on time only, means the time will not change with any factor. Whatever you do, the time will not change, but this plasma concentration will be changed due to some pharmacological factors or the patient related factors, physiological factors. The plasma concentration will be changed, means for example, if you are taking the because of the pH condition, the plasma concentration also changes. Because of the food, whatever the food you are taking, that also influence the plasma concentration. Not only that, not only the food, that pharmacological dissolution and particle size and hygroscopicity, crystallinity, morpholism, all those pharmacological pharmaceutical factors and patient factors like food, age, sex, and all those things will influence the plasma concentration. That's why the plasma concentration is dependent on the factors like pharmaceutical factors and the physiological factors. So it will be changed. That's why we are plotting against y-axis, which are not changed, which are independent. Independent means it is not dependent upon any factors, that we are keeping on a x-axis. So we are plotting against the graph and we will get a curve. That is the maximum peak curve, that we call it as a Cmax. Peak concentration, we call it as a peak concentration, plasma peak concentration. So Tmax is nothing but the maximum time taken for the maximum plasma concentration, that we call it as a Tmax. AUC is nothing but the area under curve. So the total plasma concentration we are taking, and that we are measuring by the trapezoid method and planimeter method and cut method. All those methods are we are using and calculating the AUC. Trapezoid method, we are frequently using the trapezoid method. So we have to take the curve will be divided into trapezoids, and each trapezoid we are measuring. Okay, so next one is statistical. These methods, how statistically we are calculating, means by using Cmax, AUC by the Innova method. By using Innova method, we are calculating the Cmax and AUC. And Tmax is analyzed by the non-parametric methods, and geometric means also we are using for the Cmax T and Cmax R. And the geometric means ratio like Cmax T by means divided by Cmax T divided by Cmax R we are calculating. Not only that, calculating the 90% of the confidence interval by geometrical mean ratio also we are calculating. These are the statistical evaluations. Next one, establishing the BE. So how we have to take means 90% of the calculated 90% of the confidence interval of the Cmax and AUC should be fall within the range of 80 to 95. So we have to consider 80 to 190, 125 percentage of the bioavailability only you have to consider. See, bioavailability always expressed in the percentage only. So below 80% we are not considering. That means BE is failed, and 125 above that also we are considering as a fail to demonstrate. So what we are taking the percentage means 80 to 125 within the range of the biological equivalence only we are taking. So this is about the measurement of bioavailability, means a study design. Okay.